Hello, my name is Daniel Mitzi, and I'm a clinical pharmacist, and the purpose of my presentation today is to provide a general overview and hopefully a better clinical understanding about Targeted Medical Pharma's medical foods and direct-consumer products. Targeted Medical Pharma is a Los Angeles-based biotechnology company that develops a wide range of natural, medically validated, FDA-regulated therapies that are classified as medical foods, that are used for the treatment of hypertension, obesity, sleep, pain, stress, and cognitive disorders, which are sold directly to physicians, pharmacies, online pharmacies, and long-term care facilities. Recently, Targeted Medical Pharma has also launched their first direct-consumer product called Clearways that relieves nasal congestion, improves breathing, and provides immune support. Let's take a step back to better understand why alternative therapies, like medical foods, should be seriously considered by looking at the safety track record and costs of treating drug reactions for prescription drug therapies every year. Every year, according to a report in the Journal of the American Medical Association, they found that prescription drugs that were properly prescribed killed around 106,000 Americans each year. That's 3 times as many that are killed by automobiles each year, making prescription drug death the 4th leading killer after heart disease, cancer, and stroke. If you combine the number of improperly prescribed drug therapies in the United States, that results in about another 80,000 deaths from prescription drug therapies, which then makes prescription drugs the leading killer after heart disease and cancer. Adverse drug reactions also account for 7% of all hospitalizations and cost over $100 billion annually in the United States. Also, around 6 to 15% of hospitalized patients, it's around 2.2 million persons in the United States, experience a serious adverse drug reaction. In addition, most adverse drug events are highly underreported, especially since most post-surveillance schemes are voluntary and the regulatory authorities tend to act later than sooner to help circumvent medical misadventures, despite signals of drug safety issues, which tends to lead a wide number of individuals at risk for adverse drug events until the regulatory authorities are able to establish new criteria for drug usage or warnings that are aimed at restricting or that actually suggest withdrawal of the drug therapy in certain or all patient populations. Thus, although drug therapies play a clear role in helping treat disease, at the same time they can also play a large role in causing disease. Thus, increased emphasis and consideration should be placed on utilizing safe and effective non-pharmaceutical therapies like medical foods within our integrated medical system. Most adverse drug events are the result of drug interactions. It's pretty simple. The more drugs a person takes, the higher the risk of developing a drug interaction will be. For instance, in patients that take 2 medications together, it's estimated that the risk for developing a drug-drug interaction is around 6%. It increases to 50% if the patient's taking 5 medications together. And if you take 6 medications together, it's suggested that they could have a risk as high as 80% of developing at least one drug-drug interaction. The elderly, which account for about 1/3 of all prescription medications used in the United States, are particularly susceptible to polypharmacy issues, not only because of the effects of aging and how their bodies handle medications, but just because they tend to take more medications and often have poorer health as compared to younger patients. As we get older, our body composition changes, which essentially reduces our body size. This is because they have less body water, less body weight, more body fat, fewer protein stores, and have less ability to clear drugs via the liver or kidneys, which may lead to drug accumulation, which in effect increases the amount of drug exposure per body weight. In addition, The elderly compared to non-elderly also have less ability to compensate and tolerate drug side effects. Some estimates show that up to 30% of all hospital admissions involving elderly are due to some sort of drug-related problem. Unfortunately, too often in older patients, drug reactions are simply missed or dismissed as part of the normal aging process. Thus, medical foods should be strongly considered in elderly populations or in any patient who wants to improve clinical outcomes without relying on potentially dangerous drug therapies that may increase the risk of adverse drug events and cause poor patient outcomes. The main point I want to make on this slide is that medications, along with their potential benefits, can also deplete nutrients from our body, which contribute to the medication's risk for side effects and may severely limit the medication's effectiveness or even help promote the development of new medical disorders. Targeted Medical Pharma's products do not contribute to nutrient depletion and are specially formulated to promote nutrient repletion for specific disease states. Many drug therapies often lose their effectiveness after repeated administration over time. Attenuation reflects a drug's decreased response over a short period of time and may involve, for example, rapid receptor desensitization, whereas tolerance reflects a decreased response that usually occurs over a longer period of time, let's say a week or greater, which may be exemplified by a drug that acts like an agonist that promotes a certain neurotransmitter's release, but in excess of the neuron's presynaptic production, which will then eventually reduce the drug's effect over time. The bottom line in any case is that the patient's reaction to a specific drug at a particular dose or drug concentration is reduced following repeated use or exposure, which usually requires an increase in the drug's dose to achieve the desired therapeutic effect, which can further increase the patient's risk for developing drug-related side effects and possible life-threatening adverse drug events. On the other hand, Targeted Medical Pharma's products utilize a patented system called Targeted Cellular Technology, which I will explain in more detail later in this presentation, that helps ensure our products do not develop attenuation or tolerance and maintain their effectiveness throughout the duration of their use. Therapeutic drug monitoring is the clinical practice of measuring specific drug levels at designated intervals to maintain a constant concentration of drug in a patient's bloodstream, especially with drug therapies that have a narrow therapeutic index, meaning that they can easily reach either subtherapeutic or toxic levels with only slight dose modifications or adjustments. For instance, carbamazepine, valproic acid, and phenytoin are antiepileptics that can be used to treat neuropathic pain, but require close therapeutic drug monitoring to ensure efficacy and to prevent excessive adverse events or toxicity. On the other hand, medical foods like Theramine or Purcura, which are also used to treat neuropathic pain, have a very high safety profile, thus do not require expensive therapeutic drug monitoring or place patients at risk for medication misadventures. Medical foods have actually been around for a long time in the United States and were first defined as foods for special dietary use in 1941, but were officially defined as medical foods in 1998 and are a unique category that are regulated under the FDA. Targeted Medical Pharma's medical foods, and even their direct consumer products, really do bridge the gap between drugs and nutrition, since all their formulations and therapeutic claims are substantiated by recognized scientific principles, peer-reviewed literature, physiologic testing, and open and double-blinded trials. It is important to note that our products not only help restore the nutrients we need to manage disease, but also help restore the function of the system we are managing, because Nutritional deficiencies have been linked to the initiation or exacerbation of virtually all diseases, unlike drug therapies that often treat symptoms only at the cost of dangerous side effects and adverse drug events. So what is GRAS, or generally recognized as safe, mean? Well, in 1958, Congress recognized that many food substances would not require a formal pre-market review by the FDA to assure their safety, either because their safety had been established by a long history of use in foods, or by the virtue or the nature of the substance. Thus, a list was developed that designated various food ingredients to be considered GRAS, which now contains over 700 food products. It is important to note that for a food product or ingredient to receive GRAS status, which is the highest level of food safety designated by the FDA, all the food additives require technical demonstration that they are safe and non-toxic at a specified dose. They must be recognized among qualified experts as safe under conditions of intended use. And it's important to note that many experts actually believe that GRAS status is a higher standard of safety than that is applied to drug therapies, since drug therapies may be only safe for a specific patient population for a specific period of time, whereas many GRAS ingredients are considered safe for the general population, having been consumed by millions of people, and in some cases for hundreds to thousands of years, thus having stood the test of time for consumer safety. I would now like to take a moment to compare our company's medical foods to both dietary supplements and drug therapies. When we compare medical foods to dietary supplements with respect to scientific requirements, medical foods must be medically validated, whereas dietary supplements do not have this requirement, and in some cases, this information may not even be available. With respect to target population, medical foods are intended for disease populations, whereas dietary supplements are generally meant for healthy patient populations, with their use focusing more on prevention or support rather than direct disease management. With respect to safety, medical foods have GRAS status, which is the highest level of food safety designated by the FDA, whereas most dietary supplements do not have GRAS status, although they are thought to be reasonably safe. With respect to tolerance or attenuation, Targeted Medical Pharma's medical foods do not experience tolerance or attenuation, which may or may not be true for dietary supplements depending on the nature of the supplement. For instance, the body's response to a supplement like 5-HTP, which is an amino acid precursor for serotonin, if used alone without our company's patented targeted cellular technology, may actually attenuate or develop tolerance over time. With respect to nutrient depletion, Targeted Medical Pharma's products do not cause nutrient depletion and are actually formulated to help restore various nutrient levels, whereas dietary supplements, although not commonly implicated in causing nutrient deficiency, may worsen nutrient deficiencies depending on the nature of the product, or if you use more than the recommended dose. For instance, if you take too much zinc, it may cause a copper deficiency. When we compare medical foods to prescription drug therapies, prescription drugs, like medical foods, must be medically validated, and both are indicated for diseased patients. With respect to safety, prescription drugs require FDA pre-approval for safety, unlike medical foods that are made from GRAS ingredients that have upfront and inherent safety for the general population. This may not hold true for drug therapies that may only be safe for a particular patient population for a specific period of time. With respect to tolerance or attenuation, our medical foods do not experience tolerance or attenuation, but many prescription drug therapies do experience rapid tolerance and attenuation, like opioids, nitrates, and benzodiazepines, in addition to causing dependence and withdrawal symptoms. With respect to nutrient deficiencies, unlike medical foods that actually help restore nutrient deficiencies, drugs can cause nutrient deficiencies. For instance, a common pain reliever, acetaminophen, can deplete the liver from glutathione, which is needed to detoxify acetaminophen, which can then later lead to liver failure. Just to note, acetaminophen toxicity is the #1 cause of hospital admission for liver failure in the United States. Another example would be statin drugs. These deplete your body from a nutrient called coenzyme Q10, which is needed for mitochondrial respiration, which can lead to the formation of various neuropathies and myopathies. Or even antidepressants like SSRIs can increase the risk for GI and even intracranial bleeding, since they actually deplete serotonin over long term, where serotonin is required for proper platelet aggregation. Because medical foods are formulated from GRAS ingredients that have inherent upfront safety, they do not require pre-approval from the FDA. They just require proof of efficacy. For the next 4 slides, I just want to briefly review some basic physiology that should help us better understand how Targeted Medical Pharma's products work. Neurons are the functional unit of the nervous system and transmit messages to other neurons or target organs. There are 3 basic parts in a neuron: the soma, which is colored purple in this diagram, the axon, and the dendrites. The soma is the cell body that contains the nucleus and other organelles generally found in cells. The dendrites are smaller tree-like branchings that project from the soma, and their chief function is to receive signals from other neurons. The axon is a single long tube that's main function is to carry a message from the soma to the axon terminal, which are the structures at the end of the axon that eventually release neurotransmitters into the synaptic cleft. This slide illustrates how neurons communicate with one another. Neurons transmit messages to other neurons or target organs throughout the body through a series of electrochemical impulses known as action potentials. Action potentials are initiated by a stimulus that has reached a certain threshold, which then causes sodium channels to open, which then allows the cell membrane to depolarize. Neurotransmitters are manufactured by amino acid precursors in the presynaptic portion of the neuron and stored in structures called vesicles. Once a stimulus reaches a certain threshold, sodium channels open, which then later allow the nerve to fire, which will later allow calcium channels to open, which are essential for neurotransmitter release into the synapse, where they will bind to postsynaptic receptors, which will decide whether or not to continue or discontinue the nerve transmission or action potential based on the neurotransmitter, whether it's excitatory or inhibitory in nature. Neurotransmitters that are released into the synapse are then either broken down by various enzymes or recycled through a process called reuptake. It is important to note that neurotransmitters regulate our body's key organs and body functions, like heart rate, respiratory rate, gastrointestinal function, appetite, sleep, sexual performance, blood pressure, immune system, memory, and mood and response to pain. Some examples of neurotransmitters found within our body include acetylcholine, which is the most abundant neurotransmitter in the body. It's involved with memory, cognitive function, increases muscle function, helps produce REM and restorative stage 4 delta sleep, promotes the synthesis and potentiates effects of nitric oxide and serotonin, helps reduce pain and inflammation by helping activate parasympathetic nervous system, which suppresses pro-inflammatory cytokines and substance P. You have neurotransmitters like norepinephrine that are excitatory neurotransmitters. They can help decrease appetite by inhibiting the hunger hormone norepinephrine Y, increase heart rate, enhance alertness, arousal, mood. They help reduce and also modulate neuropathic pain. Epinephrine is another neurotransmitter which has very similar effects as norepinephrine. Dopamine is another catecholamine neurotransmitter that controls voluntary movements of the body and is associated with the reward mechanism and pleasure centers of the brain. It can also help reduce carbohydrate cravings. It's important to note that low levels of dopamine are associated with Parkinson's disease, while excess levels of dopamine are associated with patients that have schizophrenia. Another neurotransmitter I want to talk about is GABA. It's an inhibitory transmitter, and it can help dampen pain signals from the spinal cord. It also can help with the initiation and maintenance of sleep. It's important to note that low levels of GABA are associated with anxiety disorders. Another neurotransmitter, serotonin. It can help initiate sleep, reduce carbohydrate cravings, enhance mood, and reduce pain signals between the spinal cord and brain. It can help reduce and modulate neuropathic pain. Low levels of serotonin are associated with conditions like depression, suicidal thoughts, and obsessive-compulsive disorders. Another neurotransmitter, brain histamine, suppresses appetite by inhibiting the hunger hormone neuropeptide Y. It reduces pain and inflammation by increasing naturally occurring glucocorticoids that inhibit prostaglandins. Another neurotransmitter, nitric oxide, it helps cause vaso and bronchodilation, decreases blood pressure, is involved with immune system support. It can provide mast cell stabilization and reduces pain signals to the spinal cord and reduces inflammation. Another neurotransmitter, D-serine, helps sensitize opioid receptors to opioids. I just want to provide a brief overview of the divisions and function of the nervous system. The nervous system monitors and controls almost every organ system through a series of positive and negative feedback loops. The central nervous system consists of the brain and the spinal cord, which acts as an information highway between the body and brain that enables us to interpret our external environment, control our body and mind. On the other hand, the peripheral nervous system consists of the somatic and autonomic nervous systems, which serve as a communication hub throughout our body, going back and forth between our organs and extremities. The somatic nervous system is responsible for sensation and voluntary control movement of skeletal muscles, whereas on the other hand, the autonomic nervous system, which is further divided into the sympathetic and parasympathetic nervous systems, are involved in involuntary actions of smooth muscle, cardiac muscle, and glands. The sympathetic nervous system primarily triggers the release of norepinephrine postsynaptically, which prepares the body for a flight or flight response or acute stress response, whereas the parasympathetic nervous system, which is completely complementary to the sympathetic system, primarily triggers the release of acetylcholine, which enables our bodies to rest and digest. So how do Targeted Medical Pharma's products manage disease? Well, I think this slide sums up how our products help address disease by essentially providing the correct blend of amino acids, nutrients, and botanicals to fuel the production of required neurotransmitters that help provide balance and support within the divisions of the nervous system and help restore various neurotransmitter production and functionality within the body. It's important to note that neurotransmitter depletion is a well-documented cause for initiating or exacerbating many disease states and often develops as a consequence of medication use, environmental toxins, increased nutrient demands, for instance during disease or stress, or due to insufficient nutrient intake. This slide illustrates what I mentioned previously regarding how neurotransmitters interact with target cells. Since neurotransmitters are too large and hydrophilic, they cannot readily pass through the lipid-based plasma membrane. Thus, they need to bind to receptors on the cell surface and rely on a variety of secondary messenger systems like cyclic AMP that actually provide the energy to activate various protein kinases to eventually elicit a certain cellular response within a target organ. Often drug therapies that rely on secondary messenger systems exhibit tolerance or attenuation because of downregulation of adenyl cyclase, which is needed to convert ATP to cyclic AMP. That essentially provides the energy that is necessary to promote a cellular response within a target organ. Targeted Medical Pharma's products protect against downregulation of adenyl cyclase, thus helping prevent the occurrence of attenuation or tolerance. This slide just illustrates that many drug therapies like Targeted Medical Pharma's products also rely on similar secondary messenger pathways to promote a certain physiologic response. In this slide, I just wanted to review how Targeted Medical Pharma's products should be properly administered. Since they are formulated with a blend of amino acids and amino acid precursors, they are best taken on an empty stomach or at least 30 minutes after a meal to help ensure our products are properly absorbed, since amino acids found in meals may compete for the absorption of amino acids found in our products. It's important to point out that our products can also be paired with or co-administered with many drug therapies safely, since our products do not affect the pharmacokinetics of drugs. In addition, since our products often work by supporting similar targets as drug therapies, just in a natural way, often they experience synergy, which enables dramatic drug dose reductions, which then reduces the risk for drug-related side effects, adverse drug events, and improved patient outcomes. So why should you consider using Targeted Medical Pharma's medical foods? Well, first and foremost, they help address disease in a natural and drug-free way. Our products only contain amino acids, nutrients, and botanicals. They're regulated by the FDA. Our products are manufactured under current good manufacturing practice regulations. Our efficacy and disease claims are based on recognized scientific principles, peer-reviewed literature, physiologic testing, and open and double-blinded clinical trials. Our products are made from food ingredients that are generally recognized as safe, which is the highest safety standard given to foods by the FDA in the United States. Our products have no harmful side effects. They're not habit-forming. They have little to no drug or nutrient interactions. Our products do not alter the pharmacokinetics of drugs. They do not require expensive therapeutic drug monitoring, or they don't require dose adjustment for renal or liver dysfunction. Unlike most drug therapies that treat symptoms only, our products help address specific nutrient imbalances, which have been linked to the initiation and exacerbation of virtually all diseases. Our products are effective standalone therapies. You can co-administer our medical foods with pharmaceutical agents that helps dramatically reduce drug dosing and drug-related side effects and maximize therapeutic outcomes. Our products offer healthcare practitioners with an additional medical tool to help manage various disease states without the risk of additional drug-related side effects or medical misadventures that can result from pharmaceutical agents, especially in patients taking multiple drug regimens. And so it helps prevent the risk of polypharmacy. Also, our products can be safely used in children. And unlike many pharmaceutical agents that lose their effectiveness over time, our patented technology ensures our medical foods maintain their effectiveness without decreased response or tolerance throughout the duration of their use. As you can see in this slide, Targeted Medical Pharma's products are formulated to treat a large patient demographic that suffer from obesity, hypertension, sleep, stress, and pain disorders. As you can see on this slide, Targeted Medical Pharma is working on many new therapeutic treatment targets that address autism, anemia, diabetes, asthma, Parkinson's disease, and even Alzheimer's disease. It is important to note that soon Targeted Medical Pharma will launch their new autism product that has been shown to significantly reduce outbursts, anxiety, and also help with improvements in socialization. And on the average, based on preliminary studies, it showed an 83% improvement in these factors upon baseline. Also, Targeted Medical Pharma has had some very promising preliminary results with their new erythropoietin stimulating product for anemia, which raised hemoglobin levels an average of 11.39% within 45 days of product use without any harmful side effects. As you can see, there are a lot of potential new therapeutic targets that our company is investigating that will hopefully provide clinicians with safe and effective alternatives to help manage these disorders. I just want to point out on this slide that Targeted Medical Pharma's natural erythropoietin stimulating product that's being studied was able to significantly increase reticulocyte counts. Now, reticulocyte counts are premature red blood cells that measure bone marrow activity, and was able to do this within a week of initiation of the product, which is similar to, if not even slightly better, than what is seen in traditional erythropoietin stimulating agents. But it was able to do this without any harmful side effects. It's important to point out that the FDA now has many strong warnings against traditional erythropoietin stimulating agents and does not recommend their usage until a patient's hemoglobin is less than 10 grams per deciliter, since these products can significantly increase the risk for heart attack and stroke, blood pressure, increased tumor growth, and patient death. Thus, if a product like this is found to be useful in larger clinical trials, it would enable anemic patients to be treated sooner as compared to later with traditional erythropoietin stimulating agents, thereby improving patient quality of life, reducing risk for adverse drug events, and helping significantly reduce healthcare expenditures. For the remainder of this presentation, I intend to only provide a brief description and some clinical perspective for each of Targeted Medical Pharma's products, since more detailed clinical information can be requested directly from the company. Clearways is marketed as a dietary supplement rather than a medical food, and provides quick sinus relief, improves breathing and immune function by helping augment nitric oxide levels in the nasal passages and airways, which then helps reduce congestion and inflammation, improves breathing, and naturally helps stabilize mast cells. The product also helps augment acetylcholine levels, which help modulate an overactive immune response. The product also contains grapeseed extract, which further helps reduce nasal congestion and inflammation. It's important to note that Clearways relieves nasal congestion without increasing blood pressure or heart rate, which is common when you utilize stimulant decongestants like pseudoephedrine. So it can be safely used in patients with heart disease or high blood pressure, and does not cause dizziness or drowsiness like many over-the-counter decongestant products that contain first-generation antihistamines like diphenhydramine. And first-generation antihistamines, as you know, can increase the risk for falls, can worsen cognition, can worsen symptoms of BPH or benign prostatic hypertrophy in men, cause or even worsen constipation, or even cause weight gain. Clearways can also be used safely every day, unlike many oral or especially nasal spray decongestants that commonly can only be used for a maximum of 3 to 5 days due to the risk of rebound congestion, which can develop due to rapid product attenuation, which actually worsens sinus congestion to levels that are even worse than were experienced prior to the use of the nasal spray product. Thus, Clearways should strongly be considered as a safe alternative to oral or nasal pharmaceutical decongestion products, and even as an alternative to nasal steroid therapies. This double-blind trial illustrates how Clearways rapidly attains maximal clinical effect within about 30 minutes to an hour. Theramine is one of Targeted Medical Pharma's most popular and studied products. It contains a blend of amino acids and nutrients that help increase nitric oxide, serotonin, brain histamine, serine, GABA, and acetylcholine neurotransmitter levels that in turn help reduce or dampen pain and inflammation for acute and chronic pain syndromes like back pain, arthritis, muscle pain, fibromyalgias, and neuropathic pain. It's important to note that its pain-relieving effects have been clinically proven to be better than ibuprofen and naproxen, but does not share the risks of taking NSAID therapies. It also does not share the risk of taking opioids or acetaminophen, or even other therapies like anti-epileptics, which are commonly utilized to treat neuropathic pain. There are just several take-home points I want to mention on this slide. On the top, when a pharmacoeconomic analysis was done that compared the costs of theramine versus the total costs of NSAIDs, taking into account managing or preventing NSAID-induced GI bleeds through using products like proton pump inhibitors, and also looking at the costs of treating active GI bleeds, there were considerable cost savings with theramine as compared to NSAID therapies. This did not even take into account the additional healthcare costs that you would incur by avoiding other NSAID-induced health risks like heart attacks, stroke, liver, or renal failure. By the way, there have never been any reports of GI bleeds with theramine, with over 45 million doses given. Theramine actually helps protect against GI bleeds by increasing nitric oxide levels, which promote mucus production, which in turn protects the gut from irritation and ulceration. And theramine also increases local gut serotonin levels, which help support local gut platelet aggregation, rather than NSAIDs, which reduce platelet aggregation, which can actually worsen the severity of a GI bleed. Also, theramine, if it's taken with an NSAID therapy, can help provide GI protection against NSAID-induced GI bleeds. The lower diagram just helps illustrate theramine's dose reduction effect it can have with NSAID therapies. As you see in this diagram, it shows when theramine was paired with a daily dose of naproxen, 250 milligrams per day, it provided nearly equivalent analgesic effect as if the patient was taking naproxen 250 milligrams 4 times a day. This slide simply illustrates that people with pain syndromes have reduced levels of various amino acids like arginine, serine, histidine, and tryptophan. And on this graph, it's depicted in blue, patients with pain syndromes. And normal concentrations of these amino acids are depicted in green. And after they took theramine therapy, they went up. They were restored, these amino acid levels, and that's depicted in red. And when we're able to restore these amino acids to help, once they're restored, the body can then produce the necessary neurotransmitters that help reduce pain and inflammation. As you can see in this slide, when theramine was studied in patients suffering from back pain, it significantly reduced pain levels on its own, but showed synergy when combined with naproxen. The take-home point of this slide is that theramine was able to reduce a key inflammatory marker, C-reactive protein, which was further reduced when used in combination with naproxen. It is important to note that therapies that reduce CRP levels may also have a cardioprotective effect, since CRP has been shown to be a strong independent risk factor for future cardiovascular events. It is interesting to point out that when naproxen was administered on its own, it caused significant elevations in CRP levels. I cannot fully explain this rise in CRP, although NSAID usage has been linked to cartilage breakdown in osteoarthritis, which may induce elevations in CRP levels. Or this may be a result of some sort of NSAID-induced oxidative stress that increased inflammation within the body. This slide just points out that Theramine, when used in patients with back pain, improved their functionality, which was further improved with a small daily dose of naproxen. This slide just illustrates that when theramine was utilized as a standalone therapy in patients with low back pain, that it reduced pain levels and increased functionality. And when it was used in combination with ibuprofen therapy, it further reduced pain levels and further increased functionality. Purcura contains a blend of amino acids and nutrients that reduce pain and inflammation. It is important to point out that this formula is designed to increase the effects of serotonin and norepinephrine, like tricyclic antidepressants or serotonin norepinephrine reuptake inhibitors like Effexor, Pristiq, or Cymbalta. But instead of blocking reuptake, it actually increases the production of norepinephrine and serotonin neurotransmitters in a natural way, without harmful side effects or worsening nutrient deficiencies. Purcura is also formulated to increase the effects of GABA, like GABA agonists, like gabapentin or Lyrica, but does this in a natural way as well, by increasing the production of GABA, without side effects like drowsiness, weight gain, edema, or cognitive dysfunction. Also, unlike drug therapies, Purcura actually attempts to restore nerve function. The formula contains creatinine, which helps with neurogenesis, meaning that it helps replace and repair damaged neural cells. And it's also considered to be neuroprotective. It also contains inositol and acetyl L-carnitine, which both help promote myelin sheath repair. In addition, Purcura, because it contains creatine, helps restore mitochondrial function in ATP synthesis, which also plays a role in restoring nerve function, which reduces peripheral neuropathic pain. Lastly, Purcura and also theramine, which is also used to treat neuropathic pain, help restore nerve circulation, which increases oxygen levels in nutrients to the nerves, while also helping reduce edema and swelling, which exerts pressure on the nerves, which can contribute to neuropathic pain. It is important to note that when there is a lack of oxygen and nutrients to the nerves, they do not operate normally. For instance, a normal nerve cell has a resting potential of minus 70 millivolts and signals pain around minus 20 millivolts. But in a nerve that lacks oxygen and nutrients, the resting of potential is much closer to minus 20 millivolts, which means that it takes much less stimuli to reach a threshold for an action potential to trigger pain. Thus, most drug therapies used to treat neuropathy do nothing to improve nerve function and treat symptoms only at the expense of severe side effects. Tretpidone is a formulation of natural amino acids and nutrients designed to reduce pain and inflammation of the joints. It contains glucosamine, which plays a vital role in cartilage formation and reduces joint space narrowing, and chondroitin, which helps maintain the elasticity and plasticity of the joint. It also contains omega-3 fatty acids and bromelain that further help reduce pain and inflammation. It's important to point out that both steroids and now even NSAIDs that are commonly used to treat joint pain have been shown to accelerate joint degeneration. And these products do little to address restoring joint function, often at the expense of severe adverse effects. Centra-AM contains a blend of nutrients and amino acids that increase acetylcholine production, which is needed for cognition and helps reduce fatigue. Centra-AM is often used along with Centra-PM for the treatment of stress disorders, which provides added support for the parasympathetic nervous system, since studies have shown that people with stress disorders like PTSD often have imbalances within their autonomic nervous system, where patients have a relatively overactive sympathetic nervous system in relation to their parasympathetic nervous system. It is important to note that cholinesterase inhibitors, like Aricept, that prevent the breakdown of acetylcholine, do nothing to address deficiencies in acetylcholine levels and can actually make them worse over time. And there have been several critiques of clinical and trials involving cholinesterase inhibitors that now actually question whether or not these therapies have any real clinical benefits at all. This slide reviews the outcomes of center-AM therapy when a tool called heart rate variability was used to examine center-AM's effect on the parasympathetic system. Basically, heart rate variability is a method that shows the variation in time interval between heartbeats, which aids clinicians in better understanding the balance between the sympathetic and parasympathetic branches of the autonomic nervous system. A high rate variability is an indication of a healthy autonomic and cardiovascular response, while a low heart rate variability may indicate that the sympathetic and parasympathetic nervous systems aren't properly coordinating to provide an appropriate heart rate response. Essentially, when heart rate variability is high, a person is experiencing low levels of stress and they have high resilience to stress. On the other hand, when heart variability is low, it's an indication of that a person is experiencing great stress, or it shows a person has a lower resilience towards stress. The high-frequency components of heart rate variability are associated with vagus nerve innervation or parasympathetic effect, whereas the low-frequency components are mainly due to sympathetic activation. Thus, if you have decreased parasympathetic nervous system activity, or you have increased sympathetic activity, this will result in a reduced heart rate variability. What makes this interesting is that it can reflect changes in stress, while other physiologic parameters may remain normal, like blood pressure. As you can see in this graph on this slide, after treatment with center-AM, this significantly increased the high-frequency component of heart rate variability, which represents improved functioning of the parasympathetic nervous system. It's important to point out that the autonomic nervous system controls so many key organs and body functions, and that any imbalance in the autonomic nervous system can be involved with even other disease states outside of stress disorders like cardiovascular disease, diabetes, or even cancer, where heart rate variability is a method to help diagnose these disorders. This slide simply points out that when there are improvements in parasympathetic function with center-AM, that corresponds with improvements in cognition and reduced fatigue. Many sleep disorders are associated with an inadequate availability of key neurotransmitter precursors like choline and 5-HTP that are involved with sleep. Center-PM provides choline, which helps produce acetylcholine, and 5-HTP, which helps increase the production of serotonin. Acetylcholine supports REM sleep and helps facilitate restful stage 4 sleep. It's important to note that REM sleep is also a very restful form of sleep because during this phase of sleep, all voluntary muscles, except for your eye muscles, as its name suggests, have no tonic activity. And your body is almost in a state of complete paralysis during this form of sleep. Serotonin helps initiate sleep and reduces the time to fall to sleep. Whereas hypnotics like benzodiazepine and Ambien do help increase total sleep times and the time it takes to fall asleep, but actually worsen the quality of sleep because they change the architecture of sleep by reducing phase 4 sleep and reduce REM sleep, which are thought to be the most restful phases of sleep. In addition, They can depress breathing, cardiovascular function, cause daytime drowsiness, reduce cognitive function. They can cause dependence. They can increase the risk for falls. They can cause life-threatening withdrawal symptoms like seizures. On the other hand, products like Centra PM and our other sleep product, Gabadone, focus on managing sleep disorders effectively and naturally without harmful side effects or risks. It's important to also point out that based on a retrospective study that was published in a journal called BMJ Open, it showed that people receiving as little as less than 18 pills per year of these hypnotics had over a threefold increased risk for death. And the effect was even higher with more pills. If a person took 132 pills or more, they had a 5 times higher risk of death, as well as a 35% increased risk of developing cancer. Gabadone is similar to Centra PM, but also contains GABA, which helps initiate and maintain sleep and provides general inhibition of the nervous system, which in turn helps reduce anxiety. I would like to point out that, unlike benzodiazepines and other hypnotics, Centra PM and Gabadone can be used safely long-term. And both of these products actually try to restore nutrient deficiencies, which are some of the underlying major root causes of sleep disorders, without causing daytime drowsiness, tolerance, dependence, or withdrawal symptoms upon discontinuation. Most weight loss drugs on the market today are associated with serious side effects and also have the potential for dependence and abuse. For instance, stimulant weight loss medications, which are the most commonly prescribed, can only be used short-term, and they can often increase blood pressure, heart rate, cause insomnia, nervousness, blurred vision, restlessness, headache, and upon discontinuation also have withdrawal effects. Other products that are used for managing weight, like Quismia and Belvic, can be used long-term, but they may cause birth defects. They carry their own cardiovascular risks and can cause cognitive impairment and withdrawal-like reactions upon discontinuation. Lipase inhibitors can also be used long-term, but can cause gas, fecal urgency, soft stools, fecal incontinence, and vitamin deficiencies, especially fat-soluble vitamins. On the other hand, as you can see on this slide, Aptrim is effective at reducing appetite and weight by naturally addressing the nutritional requirements of obesity and metabolic syndrome by stimulating serotonin and dopamine, which help reduce carbohydrate cravings, norepinephrine and brain histamine neurotransmitters that in turn inhibit the hunger hormone neuropeptide Y, and this product can be used long-term without any harmful side effects or risks. It is important to point out that new research that now focuses on amino acids and their metabolites have shown that there are disruptions in normal amino acid metabolism in obese and insulin-resistant people, suggesting products like Aptrim that address amino acid and neurotransmitter deficiencies may play a key role in promoting weight loss and weight management and helping regulate metabolism, which are not currently addressed at all by pharmaceutical therapies. Hypertensa effectively addresses the increased nutritional requirements of hypertension through a blend of natural amino acids and nutrients that increase nitric oxide neurotransmitter production, which modulates arterial flexibility and vasodilation without harmful side effects, unlike those found in common antihypertensive therapies, which can cause fatigue, lethargy, dry cough, fluid retention, rebound tachycardia, erectile dysfunction, dizziness, or even constipation. There are even reports that beta blockers and ACE inhibitors can significantly increase the risk for cataracts. Also, a recent 2013 Cambridge University study showed that popular ACE inhibitors have been linked to sudden renal failure, which is fatal in up to 30% of the cases. While on the other hand, nitric oxide actually helps preserve and support renal function. It's important to note that hypertensa, since it increases nitric oxide production, similar to nitrates, may also have similar properties as nitrates, and may actually help reduce preload and reduce afterload. And this may be especially useful in patients that have heart failure, and also help possibly reduce symptoms of angina as well. Lister V is a source of amino acids, biogenic amines, and other nutrients that address the increased nutritional requirements for patients with viral infections and impaired immune function. The product also contains echinacea, which stimulates the growth and activity of cells of the immune system, such as the macrophages, natural killer cells, and T cells. I don't want to get into the exact mechanisms of each component of this product, since that would be a lecture on its own. However, collectively, Lister V can reduce viral, bacterial, and fungal growth by increasing the overall immune function response, while also providing the necessary nutrients and cellular building blocks to help ensure proper immune system modulation, which can further help protect against DNA and other cellular damage that can occur during the immune response. Lister V has been shown to statistically reduce the severity of the symptoms and the duration of the common cold in herpes simplex induced cold sores. However, since the ingredients found in Lister V can also reduce bacterial and fungal growth as well, this product may also be considered for a wide range of other applications or indications that may require further immune or pharmaceutical support. For instance, high-risk postoperative patients who are at risk for development of postoperative infections, or this product may also provide synergy or patient support not only with that require antiviral therapies, but also in patients that require antibiotic and antifungal therapies as well. Medical foods must be manufactured under current good manufacturing practices, which are FDA-mandated standards or guidelines that provide a system of processes, procedures, and documentation to assure a product has the appropriate identity, strength, composition, quality, and the purity that appear on its label. It is important to point out that the FDA does not certify companies to be in compliance with current good manufacturing practices, but instead inspects manufacturing facilities and issues observations, identifying the manufacturing site's compliance with current good manufacturing practices, or identifies deficiencies that require immediate correction. On the other hand, NSF certification, which complies with national and international standards and regulations, provides added assurances to consumers and healthcare practitioners that products are manufactured from the highest standards of quality control and consumer safety, since NSF certification often exceeds current good manufacturing practice standards and is not a one-time event, but involves regular on-site inspections of the manufacturing site and regular retesting of their products to ensure that they continue to meet the same high standards required to maintain NSF certification over time. Targeted Medical Pharma's products are manufactured at an NSF registered facility. Well, I hope I was able to provide you with a better clinical understanding about our company's leading edge products and provide a glimpse into the future of healthcare, where we can now manage disease safely and effectively without the risks of medical misadventures. If you have any questions or want to learn more about our products or would like to become a distributor, please contact Marcus Charvastra or go to our website www.tmedpharma.com. Thank you.